So you're wondering if your pelvic pain is STD or pelvic floor dysfunction. That's the subject of this video, how to tell the difference. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy in Irvine, Orange County. I, in my practice, see patients with pelvic floor dysfunction, and one of the first things that people have in mind, especially younger individuals, is this STD? While that's not within the realm of my expertise, I can tell you that there are things you can do to find out. For example, if you do testing, you can check to see if you have STD. You can, and not every infection is sexually transmitted disease. So you could have infection that gives you painful urination, gives you pain in your pelvic floor and in your pelvis. So we want to rule out, we want to do blood workup, we want to do urinalysis to rule out any kind of infection. If it is infection, then your primary care doctor or your urologist can prescribe the medication to get rid of that. However, you can have pelvic floor dysfunction with the painful urination, painful intercourse, painful ejaculation, or pain after ejaculation, I should say, and pain and movement in general in this vicinity. And it doesn't have to be in men only. So just make sure you don't start wondering in the wrong neighborhood of thinking and thinking your pelvic floor pain is STD or infection, or think, oh, it can't be that, it has to be this. It needs to be ruled out. So if you were to come into my practice, depending after comprehensive consultation, listening to your story and evaluating what's going on, I may or may not recommend a blood workup to rule out or rule in certain diagnoses. So just be aware of that. And if you have any questions, contact one of the methods of contact in the description box. And we'll see you in the office. Take care.